What is transverse myelitis versus MIS? Imagine two conditions that both involve inflammation in the nervous system, but affect different parts and have different patterns. That's what we see with transverse myelitis and multiple sclerosis. Both are inflammatory disorders that damage the protective covering of nerve fibers, called myelin, in the central nervous system. But their differences are important for understanding diagnosis and treatment. Multiple sclerosis is a long-term autoimmune disease where the immune system mistakenly attacks myelin in multiple areas of the brain and spinal cord. This causes scattered patches of inflammation and scarring, known as sclerosis. Because it affects multiple parts of the central nervous system, symptoms can vary widely. People might experience vision problems, weakness, numbness, difficulty walking, or problems with coordination. These symptoms often come and go, with periods of flare-ups and remission, which is typical of the relapsing-remitting form of MIS. Transverse myelitis, on the other hand, is a more localized inflammation that affects only the spinal cord. The term transverse refers to the fact that the inflammation usually spans across the width of a segment of the spinal cord. This leads to symptoms that develop quickly, often over hours or days, and are symmetrical below the affected level. People might suddenly experience weakness, numbness, or tingling in the limbs, along with bladder or bowel issues. Because the inflammation is confined to the spinal cord, the symptoms are usually focused there and tend to be more sudden and severe. The causes also differ somewhat. Multiple sclerosis is a chronic autoimmune disease with ongoing immune attacks on myelin, often with a relapsing and progressive course. Transverse myelitis can be idiopathic, meaning no clear cause is found, or triggered by infections, autoimmune conditions, or other inflammatory processes. Many patients with transverse myelitis recover partially or fully after treatment, but some may have lasting disability or go on to develop MIS later. One key link between the two is that transverse myelitis can sometimes be the first sign of multiple sclerosis. If someone has a transverse myelitis episode, especially if MRI scans show lesions in other parts of the central nervous system, they might be diagnosed with MIS later. Conversely, not everyone with transverse myelitis develops MIS, especially if the inflammation is complete and the symptoms are severe. MRI imaging helps doctors distinguish between the two. In transverse myelitis, lesions are usually localized and extensive in the spinal cord, while in MIS, lesions tend to be smaller, scattered, and found in both the brain and spinal cord. Treatment for both conditions often involves high-dose corticosteroids to reduce inflammation. For multiple sclerosis, ongoing disease-modifying therapies are used to prevent relapses and slow progression. Recovery from transverse myelitis varies. Some people recover fully, while others may have residual weakness or sensory changes. Long-term management depends on the individual's symptoms and whether they develop MIS. In summary, transverse myelitis is an acute inflammation limited to the spinal cord, often presenting suddenly and with symmetrical symptoms. Multiple sclerosis is a chronic, relapsing disease affecting multiple parts of the central nervous system, with symptoms that can fluctuate over time. Recognizing these differences helps healthcare providers tailor diagnosis and treatment plans. Always remember, if you or someone you know experiences neurological symptoms, it's essential to seek medical advice for proper evaluation and care.